Before modern anesthesia, American surgery was not a medical procedure. It was a test of how much horror the human body could survive. Patients entered the room awake, surrounded by men with sharp tools, stained coats, and a plan that would sound completely insane today. There was no peaceful sleep, no comforting countdown, no guarantee you would leave the room in the same condition you entered it. The surgeon had only minutes to act. The patient had almost no way to escape the pain, and one small mistake could turn treatment into a death sentence. This is the side of weird history most people never hear about. A collection of crazy historical facts so disturbing, so unbelievable, and so brutally real that you will keep asking yourself the same question. How did anyone survive this? And by the end of this video, the answer may be worse than you expect. Before reliable anesthesia, American doctors did not truly eliminate pain. They tried to weaken it, distract from it, or keep the patient from moving long enough to finish the operation. Whiskey was one of the most common options. A patient might be given enough alcohol to become drowsy, confused, or less terrified. The problem was that alcohol could not reliably block severe surgical pain. It might make you slower to react, but it would not convince your nerves that a knife was merely offering constructive criticism. Opium was another important tool. Doctors sometimes used opium preparations such as laudanum, a mixture of opium and alcohol, to calm patients and reduce suffering. It could make a person sleepy and dull some pain, but the effect varied widely. Give too little, and the patient still felt almost everything. Give too much, and breathing could slow dangerously. So early American pain control was basically a medical guessing game, where losing meant either unbearable agony or accidental poisoning. Some physicians also experimented with mesmerism, an early form of hypnosis. The idea was that a patient could enter a trance and become less aware of pain. A few cases appeared successful, but the method was unpredictable. One patient might remain calm, while another discovered halfway through the operation that his mind had officially rejected the entire concept. These crazy historical facts sound ridiculous today, but doctors were working with limited options. They knew major surgery caused extreme suffering. They simply had no reliable way to switch that suffering off. When medicine could not control the pain, doctors controlled the patient. Assistants, family members, medical students, or hospital workers might hold the patient's shoulders, arms, waist, and legs. Leather straps, sheets, or belts could also be used. This restraint was not a punishment. It was a desperate safety measure. A patient in severe pain might twist, kick, grab the surgeon, or attempt to escape the table. One sudden movement could send the knife into healthy tissue or a major blood vessel, so several people might pin the patient down while the surgeon worked as quickly as possible. In modern medicine, machines monitor your body while you sleep peacefully. In early America, your monitoring system was a sweaty assistant yelling, "He is moving again." Patients were sometimes given leather, cloth, or wood to bite. This did not reduce the pain. It simply provided something safer than the patient's tongue, the surgeon's fingers, or the arm of the nearest unlucky medical student. Doctors also tried to prepare patients mentally. They explained that the operation would be painful and that remaining still was essential. Some patients prayed, some drank heavily, some screamed before the first cut, others focused on breathing, reciting scripture, or staring at a fixed object. A famous example came in 1809 when Jane Todd Crawford underwent surgery in Kentucky to remove a massive ovarian tumor. She remained conscious and reportedly recited psalms, while physician Ephraim McDowell operated. She survived, making the case an extraordinary moment in weird history. But her experience also showed exactly what patients were expected to endure. For most people, surgery was the final option. They agreed to it only when disease, infection, injury, or a growing tumor had made every alternative worse. They were not choosing between pain and comfort. They were choosing between a fast nightmare and a slow death. And yes, that actually happened. The strangest part of these crazy historical facts is that the system sometimes worked. Not because whiskey, opium, hypnosis, and restraint were good solutions, but because patients and surgeons endured conditions that would be unthinkable today. The doctor brought the knife, the assistants brought muscle, the patient brought courage. That was the entire anesthesia department. Once the patient had been given whiskey, opium, a prayer, and several strong assistants, the surgeon faced the next problem. Finishing before pain, blood loss, and shock overwhelmed the body. In early American surgery, speed was not just impressive, it was survival. A slow surgeon forced the patient to endure more agony, increased blood loss, and gave panic more time to take control. That meant surgeons trained themselves to work with brutal efficiency. They memorized every movement before making the first cut, because this was not the moment to pause and say, "Wait, where did I put the artery?" Amputation became one of the clearest examples. When a limb was crushed by machinery, shattered by a musket ball, or consumed by infection, removing it could be the only chance to save the patient. The process usually began with a tourniquet placed above the injury to reduce blood flow. The surgeon cut through the skin and muscle with a sharp knife, exposed the bone, and used a saw to remove the damaged limb. Blood vessels then had to be tied with thread or treated with heat to control bleeding. Simple, efficient, absolutely horrifying. The patient was awake through most or all of it. Assistants held the body still while the surgeon worked. One person might control the shoulders, another the hips, and others the remaining limbs. If the patient jerked at the wrong moment, the knife could slip, the saw could move, and the operation could become even more catastrophic. This made the operating room look less like a hospital and more like several men losing a wrestling match against one extremely motivated patient. During the American Revolution and other early conflicts, battlefield surgeons regularly faced shattered arms and legs that could not be repaired. Musket balls did not politely pass through the body. They smashed bone, dragged dirt and cloth into wounds, and created the perfect environment for infection. In those situations, surgeons often amputated, because leaving the limb attached could mean gangrene, blood poisoning, and death. The operation was terrible, but the alternative was usually worse. That actually happened repeatedly. Speed became so important that surgeons built reputations around how quickly they could operate. A fast amputation could sometimes be completed within only a few minutes, but the goal was not to break a record. The goal was to reduce the amount of time the patient spent trapped in unbearable pain. Still, speed had a dark side. Moving too quickly could lead to mistakes. A surgeon might damage healthy tissue, fail to secure a blood vessel, or leave fragments behind. The patient could survive the sawing only to bleed later because one tiny artery had decided to become the final boss. These crazy historical facts reveal why early surgery was limited mostly to areas surgeons could reach quickly. Arms, legs, teeth, bladder stones, surface tumors, and visible wounds were possible targets. Operations deep inside the chest or abdomen were far more dangerous because they took longer and created more opportunities for bleeding, shock, and infection. The surgeon's tools were also frighteningly basic: knives, saws, forceps, probes, needles, thread, and cautery irons. They were designed to cut, pull, tie, or burn. Comfort was not part of the engineering process, and cleanliness was often inconsistent. A surgeon might move from one patient to another without understanding that invisible germs were traveling with him. The operation could be technically perfect, yet the patient might develop fever, swelling, pus, and death days later. That is why weird history rarely gives you a happy ending without adding an extra disease at the bottom of the page. For early American surgeons, success meant working fast, controlling the bleeding, and hoping the patient's body survived everything medicine did not yet understand. These crazy historical facts were not stories of doctors being careless. They were stories of doctors operating at the edge of knowledge with tools that looked suspiciously similar to items found in a carpenter's workshop. The surgeon brought speed, the assistants brought strength. The patient brought more courage than anyone should ever be asked to provide. And somehow, sometimes, it worked. In January of 1845, dentist Horace Wells entered Massachusetts General Hospital, believing he was about to end surgical pain forever. He used nitrous oxide on a patient during a tooth extraction, but the man cried out during the procedure. The audience laughed. Doctors dismissed the experiment as a failure, and Wells left publicly humiliated. For a moment, it looked as though painless surgery had arrived, embarrassed itself, and immediately been thrown out of medicine. But here is the part that should make absolutely no sense. A doctor had already performed a successful painless operation nearly 3 years earlier, and almost nobody knew about it. Ether quietly changes everything. That physician was Crawford Williamson, Long of Georgia. In 1842, Long used ether to place a patient named James Venable into an unconscious state before removing a tumor from his neck. The patient reportedly felt no pain during the operation. That actually happened, but the news did not immediately spread. Long continued using ether in other procedures, yet he waited years before publishing his results. In the world of scientific breakthroughs, this was the equivalent of inventing the internet and forgetting to tell anyone because you were busy. So while Long had already demonstrated that ether could prevent surgical pain, most American doctors continued operating the old-fashioned way: whiskey, restraint, screaming, and maximum emotional damage. Then, in October of 1846, dentist William Thomas Green Morton arrived at Massachusetts General Hospital with his own ether inhaler. A patient named Edward Gilbert Abbott needed a tumor removed from his neck, and surgeon John Collins Warren agreed to operate while Morton administered the vapor. This time, the room did not laugh. Abbott became unconscious. Warren removed the tumor, and the patient showed little reaction during the procedure. When the operation ended successfully, Warren reportedly turned toward the audience and declared that the demonstration was not a fraud. The message spread quickly. Major surgery no longer had to mean complete, conscious agony. For surgeons, this changed everything. They no longer had to treat every operation like a speed challenge designed by a psychopath. They could work more carefully, explore deeper parts of the body, and attempt procedures that had once been nearly impossible. For patients, the change was even more dramatic. Instead of watching the surgeon prepare a knife while 3 assistants stretched before tackling them, they could inhale ether and become unconscious. Among all the crazy historical facts in American medicine, this may be one of the most important. Ether did not simply make surgery more comfortable. It transformed what surgery could become. But anesthesia created a strange new problem. Once patients stopped screaming, surgeons became more confident. Operations lasted longer. Doctors entered deeper into the body. More complex procedures became possible. Unfortunately, bacteria were also invited. Doctors still did not fully understand germs. Surgical instruments were not always properly cleaned. Surgeons could wear the same blood-stained coat from one operation to another, treating the stains like professional decorations. Hands, tables, sponges, and tools could carry infection directly into a fresh wound. So a patient might sleep peacefully through the procedure, wake up believing the nightmare was over, and then die days later from fever, swelling, or infection. Anesthesia had defeated pain, but it had not defeated contamination. In 1867, British surgeon Joseph Lister published his work on antiseptic surgery, using carbolic acid to reduce infection. His methods eventually influenced American medicine, but acceptance was slow. Some doctors resisted the idea that invisible organisms were killing their patients, because apparently, "Please wash your hands before touching my internal organs," was once considered a radical medical opinion. This is what makes weird history so unsettling. Progress rarely arrives all at once. American surgeons learned how to make patients unconscious before they fully learned how to stop the operating room from quietly poisoning them. Ether ended one nightmare. Germ theory exposed another. So before modern anesthesia, American surgery depended on whiskey, opium, restraint, speed, and an alarming amount of courage from people who had absolutely no better option. Then ether arrived and finally allowed patients to unfortunate pain, unfortunately. That is the real lesson behind these crazy historical facts. Medical progress did not happen in one brilliant moment. It happened through painful experiments, public failures, stubborn doctors, and patients brave enough to survive treatments that sometimes looked worse than the disease. That is why weird history matters. It reminds us that every comfortable hospital visit today was built on stories so brutal and bizarre that you have to repeat, "That actually happened." So the next time a doctor asks you to count backward before surgery, be grateful nobody hands you whiskey and calls in for assistance. And if you do not want your history to be this dumb, hit subscribe for more crazy historical facts, more weird history, and more stories that actually happened. Thanks for watching.